Hi guys, I'm Dr. Tara Tobias. I want to welcome you all back to this channel. In today's home exercise tutorial, we are going to be going over something that came up in the comments last week, and that is how to rotate the leg inward. So the person that left the comment was spot on when he said that this is a pretty common problem with a lot of people after a stroke, that their leg has a tendency to rotate outward. And so I have done videos in the past on the knee flopping out and how to help correct for that, but it has been a while since I have talked about this and talked about some of the causes of this and some of the corrective exercises that you can do to decrease that amount of external rotation or that amount of that leg rotating outward when you are walking. So that is what we are going to go over today. But if you're new to this channel and you haven't yet subscribed, go ahead and hit that subscribe button, turn on that notification bell so that you'll get notified every time I upload new videos. And now let's go ahead and dive into this topic. So what causes the leg to rotate outward? Not only when you're walking, but I'm going to broaden it a little bit. If your knee flops out to the side when you're sitting, that is also external rotation. Or if your knee points out to the side when you're walking and you're trying to swing the leg through, that is also what we call external rotation. So there is a few things that can cause the leg to do this when you're trying to keep the leg straight, such as when walking and the knee's supposed to be pointing straight ahead. One is that the external rotators, or the muscles that rotate the hip outward, are just tight. That can actually start when you're in the hospital. A lot of times that leg is very weak in the early stages of a stroke, and then with blankets and stuff on top of the leg and laying in a bed for prolonged periods of time, that leg just has a tendency to flop out to the side. And if it stays like that for the sometimes 2 to 3 weeks that you're in an acute care setting where you don't really get up a whole lot, most likely if that is you, your external rotators are extremely shortened. So they've just adaptively shortened due to that prolonged positioning where that leg was left to rotate outward. The other thing that can cause this is sitting in a wheelchair or any type of chair that is poorly fitted. So if the foot plates are too short, so the place where you rest your feet is too short or up too high, then that knee is going to be up a little bit higher, and just with gravity, if that leg is weak, it just naturally will flop out to the side. So the only reason I bring that up is always make sure that your foot plate is adjusted appropriately on the wheelchair. And that just means that if you looked at your legs from the side or you looked at your thighs from the side and you're sitting in the chair, they should be parallel to the ground. So if they're angled upward, that usually means that that foot plate's a little bit too short if you've suffered a stroke or a brain injury. There are some reasons why we position the foot plate like that with certain diagnoses, such as spinal cord injuries. But if you've had a stroke or a brain injury, most likely you're in a chair where you do want that thigh bone to be parallel to the ground. So up too high, a lot of times gravity will just let that leg flop out. And if it stays like that for a prolonged period of time, again, those muscles that externally rotate the hip will just adaptively shorten. The other reason someone might notice that their leg is rotating out to the side is if you are using a synergy pattern to lift the leg when you're walking. So an abnormal flexor synergy pattern that happens after a stroke or a brain injury with hip flexion, or when you flex the hip, the leg externally rotates. That's what we call an abnormal synergy pattern in the leg. And so, of course, when you're walking, you are trying to lift that leg. You may see it rotate outward if you're using that synergy pattern to advance your leg. Along those same lines, usually we're using synergy patterns because we haven't gotten to the point yet where muscles can work independent of that synergy. So I've talked about this before, but the stages are usually you move in synergy and then outer synergy. So maybe you're not moving in synergy, but you have a poor connection with those internal rotators, so you have not created a good synergy pattern where the hip flexes and the internal and the external rotators are acting equally to keep that knee straight. So long story short, if the internal rotators are underactive, then you might see that leg flop out to the side as well. And then the other reason, and This has nothing to do with the hip muscles, but I have talked about this recently in a few videos, and I think it's important for me to continue to bring up in videos, is that we don't work things in isolation after a stroke or a brain injury, meaning that it is important to focus in on one specific problem sometimes, only if you are also zooming out and paying attention to how that one specific problem might fit into the bigger picture or into the entire body. So this is another case where you really need those two lenses of zooming in and zooming out, is that it might not be coming from the hip at all, but it might be coming from your foot. So if you're in a poorly fitting brace and your foot is rolling or supinating, then that really does have a tendency to make the entire leg roll out. So every time you go to stand on that leg is going to roll out. It's really hard to rotate that leg back in when you're going to swing it through. So always, always, always make sure that you are in a properly fitting ankle foot orthosis or an AFO. Strapping is really important, and I've talked about this recently in a few videos. The two straps that are critical are the strap that goes right over the top of the ankle and then the one that goes around the lower leg. And the best design is when those straps come from the inside of the brace, because they have better contact with the leg and they can control the leg and the foot a little bit better and keep it straight. Keep the foot and the ankle straight. You will have a better shot of keeping everything else straight up the chain. So now, what are some exercises that you can do to correct this problem? Well, of course, you need to stretch the external rotators or stretch towards internal rotation, and then movement retraining. So relearning how to isolate internal rotation and relearn how to move the leg without it externally rotating. So the stretches I like for this, and I have shown this before, but again, this is a different problem. So a lot of the exercises can be used for a variety of problems, but just laying on your back, it's always easier to stretch towards internal rotation with the knee bent to start. I like to start with the foot planted just a little bit out to the side, and then think about just dropping that knee towards your uninvolved knee. So kind of bringing the knees together, and really actually not only stretch, but learn this movement of bringing the knees together with that foot out. That's going to be one of our movement retraining exercises that we do in standing. So have that foot out to the side and then just work on bringing those knees together, but that's also stretching all the muscles that rotate that hip outward. It's also important to really stretch the external rotators or stretch towards internal rotation with the leg straight. And that is really challenging for a lot of people. I can't really explain why on this one, but having that hip straight and the knee straight and just isolating that internal rotation is usually really hard. So definitely work on that. Make sure you're just not turning your foot in. Really have someone, if you need to videotape it, or if you can prop your head up just a little bit to look down and make sure the kneecap is actually rotating inward towards the opposite knee. And then again in sitting. I like this stretch in sitting because you can get a little bit more of an aggressive stretch on those external rotators and really lengthen them. So I usually always do this with someone after we transition from mat exercises to sitting exercises. Before we stand up, I'll do this a few times just to really make sure I've prepared the body so that someone is going to be able to rotate that hip inward when we get to standing. So you guys can do that on your own. You don't really need a therapist to do this one. Just make sure you always stretch those rotators inward prior to standing up so that you're doing everything you can do to set yourself up for success. All right, now some movement retraining exercises. As usual, we're going to start laying down, then we're going to go to sitting, then we're going to go to standing. So laying down, I really spend a ton of time, probably 10 or 15 minutes on this one movement with some patients. We're just working on bringing the knee to the opposite shoulder. That's critical. Most of the time when someone goes to bring their leg up, they bring that knee up and it flops out to the side. So really working on relearning how to engage those internal rotators as you flex that hip up is so, so, so important. If you're a therapist and you're working with a patient, I would not skip over this exercise, and I would do it a ton to really start retraining that internal rotation when they lift the leg up, and what I call working out of synergy, so out of synergistic patterns. If you're doing this on your own and you really can't do it on your side, because gravity will help to just automatically internally rotate that leg. And then now in sitting, what I like, and I have shown this exercise before as well, but I really like the skateboard. It just makes it gravity eliminated, and it really does help to just isolate those internal rotators. So do this as much as you can. Try and keep those knees together, and you're just moving the skateboard out to the side. And then once you get really good at that, we take it right on to sit to stands. So this is the critical part where a lot of people see their leg flop out to the side. Now, sometimes that's because you are compensating by shifting all your body weight onto your other leg, but sometimes it is just because those external rotators are tight. So if it's because of tightness in the external rotators, I will just put the leg there, and you guys can do this to set yourself up for success. Set yourself up so that you can actually practice good quality movement, and I usually do that by just wrapping a strap around the knees, put 1 to 2 yoga blocks in between the feet. So having the feet wider and bringing the knees together, you can see that automatically internally rotates the hip and it keeps it there. And then just work on sit to stands. Now, if you're not comfortable putting all your body weight on your involved leg, definitely hold on to something, but the goal would be that you could do this without holding on to anything, so that you're not using your hands to pull up, and you really are engaging those muscles that push down with that leg while also keeping that leg internally rotated. And now this one you really have to pay attention to, because I get people that are really confused sometimes when I have one leg moving but we're actually working the leg that's not moving, and this is one of those exercises. Yes, the leg we are working is the leg that is not moving. But what you're going to do is you're going to take your uninvolved leg and try and step it over your involved leg and onto a step and then back down. Now, if your foot rolls, as I've showed in a lot of other videos, put a lateral wedge or put a wedge on the outside of that foot to stop that foot from rolling. Definitely wear your brace. I get this comment a lot with a lot of the videos that I do on leg exercises, so definitely wear your brace. Put the wedge there if your foot has a tendency to supinate or roll to the outside, and then step that uninvolved leg across and then step it back down. Now, if you can see, what you're doing is you're actually rotating your body around that involved leg, which is internally rotating that hip. So you really are working the internal rotators on the leg that you are standing on when you do these toe taps across midline. So it's a great way to work internal rotation because the foot is planted on the ground. It kind of holds that leg still, and then you're moving the rest of your body, so muscles that probably are a little bit more active around that leg, so you can really tap into some other muscles that might be a little bit more active to get that hip to really feel that internal rotation. So active leg, working leg is the leg you are standing on. The non-working side for internal rotation for this specific exercise is the leg that is toe tapping over. That is the non-working leg. We're working the leg that you are standing on. And then this is super advanced for some of you that maybe just have a little mild spasticity or a little bit of an abnormal movement pattern, but not really severe. And that's just standing on your uninvolved leg with your involved knee bent and your foot just on a chair out to the side. So a lot of times at this point in the walking cycle, right before you go to swing that leg through, is when it externally rotates. And that's where your body really needs to feel what it feels like to have that hip internally rotated at this moment when your legs are somewhat in this position in the walking cycle before you go to swing that leg through. So just sitting here and hanging out. A lot of times people will have to externally rotate a little bit just to get their foot up on the chair. But then once your foot's up on the chair, just again letting it drop. Remember I said when we did this laying down that it was very similar. This is a very similar position of just letting those knees come together. If it's staying out to the side, try not to think active commands because you actually have muscles that are overactive, and try and tell yourself to just relax. Relax the hip and see if it'll just naturally come in. And then the last one that I like is using this twister disc. They're pretty cheap. You can buy them on Amazon for about $10. I'll put a link for this in the description below, but it's basically just two surfaces that just spin on each other. It's a little bit advanced, and you do want your legs to be at the same height, so you do need to stand with your other foot on something and just work on shifting your body weight onto this leg and just rotating the leg inward. Now make sure that the knee is actually rotating inward and not just the foot. Same thing I had mentioned earlier, but you really want the entire leg to rotate inward. So use a mirror and make sure that your knee is actually rotating inward. Another thing that's really important with these standing exercises, a mirror is really valuable to make sure that you're not compensating with your shoulders or other parts of your body, to really make sure everything is staying still but the body parts that I show moving when I demonstrate the exercises. So you really want everything else to be really still. A lot of times people will actually start moving at their shoulders and they're not actually getting that movement at their hip. So definitely make sure that the movement is occurring at the leg, and you can do that either by videotaping yourself and just watching it back, or by using a mirror. And then that is it for this video. I hope you all enjoyed this. I know it was a review for some of you who have seen the series that I've done on this, but it was time for a little update. So I hope you guys found some value in this. If you haven't yet subscribed, again, go ahead and hit that subscribe button, turn on that notification bell so you'll get notified every time I upload new videos. Again, I also now offer membership programs. I mentioned that last week, and thank you for those of you who have signed up for that. It really does help to keep this channel going, so I really do appreciate that. For those of you that haven't signed up, if you want a way to support me and support this channel, hit that join button above and become a member of our Rehab Champions program. Also, if you haven't followed me on Instagram yet, you can go ahead and follow Orlando Neurotherapy on Instagram. I do pull a couple of these exercises from these videos several times a week and just make a post of the exercises. So if you want a little daily dose of just some exercises that you can try, definitely head on over to Instagram and follow me over there at Orlando Neurotherapy. And that is it for this video. I hope you guys all have a wonderful day, and I will see you all in the next video.